Steve Sherlock here for Franklin Matters. Franklin Public Radio, available anywhere, anytime on the internet, WFPR.FM. And in the local Franklin, Mass. FM radio dial. Yeah, the dial, the knobs, the button is 102.9. Preset it, and it's always there ready for you. Here today virtually with Jason Poulos, candidate for the 4th Congressional District in the September primary. Jason, welcome. Thank you for doing this.
Stephen, thank you for having me on.
You know, you're running against a one-term elected official. He came out of a fairly tight race, if you will. It was, people termed it a horse race. It was like 7 or 8. He made it through the primary, defeated the Republican, and now he's got one challenger, you. So for the benefit of the voters, let's develop a little bit about who you are and why you're taking this challenge, and then we can get into the issues that you believe differentiate you from your opponent.
And thank you for the opportunity. So I'm a product of public schools. I went to Dover-Sherburne Regional High School. I grew up here in Sherburne in the district. I went to UMass Amherst on a Pell Grant and a work-study program. I did a PhD at UC Berkeley in computational science and engineering and political science at UC Berkeley, where I was also an NSF graduate research fellow.
NSF, that's National Science Foundation?
National Science Foundation.
Okay.
And we can get into that a little bit more later because now the NSF budget has been halved in the new Trump budget.
Mm-hmm.
And so actually the directorate in which I got my PhD under, the Social and Behavioral Sciences Directorate, is no longer going to exist under the new budget because they don't have enough money to fund all the directorates.
Sure.
So a big message that I'm going to try to convey in this interview is that my story as a public school kid and someone who got a Pell Grant and someone who got an NSF graduate fellowship, that story, it's not going to be able to happen again in the future. And so that's a big reason why I'm running, is because I see a future in which opportunities for people are diminishing. And every rung of the ladder that was built for me was built by public investments, and it was built by labor. So I was also in a labor union at Harvard before I got my PhD at UC Berkeley, and I was at a labor union in UC Berkeley in the UAW. And I'm running because we're pulling that ladder up as a country, and Congress is spending more time answering to corporate donors rather than to working people. And another reason why I'm running is because I came back to Massachusetts to do a postdoc in AI and health policy at Brigham and Women's Hospital, where I was working on the intersection of artificial intelligence and health policy. And I'm looking at the state of the world, and I'm looking at these massive layoffs that are happening in the workforce due to AI. So, for instance, Oracle just announced a few months ago that they're laying off 21,000 workers. Mm-hmm. And the reason they gave wasn't that the company is no longer profitable. The reason that they gave is that human labor is no longer as valuable to them, that they want to put their earnings into the construction of these new AI data centers, which are causing a lot of environmental and health harm in the locations that they're being built.
Mm-hmm.
And we do need a lot more AI regulation policy. I don't think that there are not many people in Congress right now who have the expertise or the background that can deal with these problems. So in my campaign, for instance, I'm proposing a single AI federal regulatory agency, a board that has real teeth, that can review new model releases and see if they're safe or not, can implement new regulations concerning the use of AI, how AI can be used in society and the workforce, and would also pass on new regulations, federal level regulations that would deal with the emissions and electricity usage of these AI data centers. So there are currently no federal laws regarding AI data centers, so we have no idea how much electricity they're using, how much water they're using. It's because there's no federal reporting standards. And so that's why I would support the Clean Cloud Act, which would mandate electricity reporting standards, but I also think we should have water reporting standards.
Yeah, let's stop there and dwell in on a couple of those key points, if you will. So artificial intelligence, AI, clearly it's a giant buzzword. To a certain extent, I think the train's left the station. But I think, and you can perhaps add from your own inside the black box working of it, my assumption is while AI is neither artificial nor intelligent, there are places where, based upon the data set and the scope and the coding, there can be uses for it. But I'm not sure that everybody is aware that there are certainly misuses. And there are going to be some cases where it can never replace a manual laborer. But the office worker, yeah, potentially in some cases it could. Can you speak to that? I think one of your keys was in that AI assistance around some of the healthcare and how research can be improved in that case, which I think is one of those targeted use cases.
Right. So like you're saying, there's a complex picture that's being drawn. So on one side, there are real benefits to which AI is being used and deployed. And so one example is, so when I was a postdoc at Harvard Medical School and Brigham and Women's Hospital, what we were doing was we were leveraging basic large language models, which are these autoregressive models, and training them on patient electronic health record data. So every time you go into a doctor's office, it records the interaction. It records the prescriptions that you're given. It records the laboratory tests that you're given. It records diagnoses. It just picks up all this data over patient's entire lifespan. And so we were using patient records dating back from the 1990s, and so some patients were in these databases for 25 years.
Sure.
And so just like an immense amount of data, and the question is, can you train a model to learn on this data to predict? In our case, we were training the model on diabetes patients. Could you predict if these diabetes patients will be at risk for diabetes treatment failure in the future? And diabetes treatment failure would be defined as having their hemoglobin levels drop below a certain percentage point. And these models are actually, very adept at kind of consuming all this information about patient histories and then being able to predict patient treatment outcomes in the future. And so that's just one instance in which these AI models can be leveraged. Another instance in the health setting is, doctors, they write down a lot of notes about patients.
Right.
A lot of these notes are famously, illegible.
Cryptic.
And, but it contains a lot of valuable information because these are things that the doctor perceives about a patient that might not be captured by their numerical values, for instance, their laboratory tests.
Sure.
And so, but so far that kind of information is kind of not tapped into because they're often in paper form, they're in cursive, illegible. So, AI models can be used not only to transcribe those handwritten notes, but also kind of feed it back into the model and have the model decide what are the important predictors in those doctors' notes that can help predict something like diabetes treatment failure. So there's go ahead.
So I think I'm hearing what you're saying. In this particular, call it a model, you'd have some number of elements in a data set that would be framed to ask the question or to do the analysis. by adding the doctor's notes, you've now expanded the data set appropriately, hopefully, so that it can do a better job of making that analysis.
Mm-hmm. Exactly. And all this was done within the walls of the hospital. So we were very, careful as to making sure the model was being run within Brigham and Women's Hospital. So, for instance, we had GPU. So those are the chips that are used to power the AI models.
Mm-hmm. Right.
They're famously energy intensive, and that's the reason why AI data centers are drawing up so much energy and water, is because they're very energy intensive and they're water intensive because they need the water to cool the GPU cards. And so we had just 3 GPU chips in our little office hospital, and the office would become too hot to stay there and work because the GPUs were firing up all the time. And so we had to move outside of the hospital office.
Right. It's kind of like you've got a chip, which is relatively small, I'm assuming. It's almost mimicking kind of the mainframe days when you had the big honking set of iron from an IBM or whatever, which also needed to be water cooled and or air cooled in order to the test tubes at the time, no longer chips now that are available. But that's deviating a little bit. One of the other pieces I think you mentioned or that raises this is that to a certain extent, that kind of zoning in terms of federal level control over placement of an AI data set, that's generally been at a state or local level. I can understand from some of the systematic, i.e. certainly AI and privacy and aspects, but that other zoning aspect, how would you help justify that? Because potentially that would be a further outreach, at least to my understanding, from what the federal government would do.
Yeah. So my position officially is that we should impose at least a temporary moratorium on the construction of these new AI data centers until we start understanding the long-term environmental and health impacts of these data centers. In terms of zoning, the problem is that a lot of these data centers are being put into communities that are low income, where maybe there's the local opposition hasn't been fully formed. And so one case is in Lowell with the Markley data center. And often residents aren't given, I think, a full accounting of what the long-term impacts of these data centers are. And in Northern Virginia, there's this thing called Data Center Row, where just a row of data centers have been built, and there have been academic papers published that show long-term health consequences because the data centers, the generators emit particulates into the air that's being breathed by people, and the water, well area is being, dried up. And so I do think that this is a issue in which maybe the local governments and the state governments haven't been fully equipped in dealing with. And I think it is time for the federal government to step in terms of creating a moratorium on the construction of new data centers, also imposing these regulatory standards in terms of reporting requirements, because we don't know how much the data center is being emitting in terms of energy usage. And I would just note that there are some success stories. So in Mansfield was the first town in Massachusetts to pass a ban on the construction of all data centers. So all data centers above a certain
capacity
threshold.
Size. Yeah. Okay. Shifting a little bit, one of the pieces I noted in your campaign, you're not taking any corporate funding. You're certainly doing kind of the crowdfunding for that term. One of the things that I picked up over the years, and I think you're highly interested in reversing or getting better legislation to overturn the Citizens United decision. Can you elaborate on that?
Yes. So I think the money in politics is the root cause of why we can't get large progressive legislation passed. An example of that being Medicare for all, a universal health
Hmm.
insurance system. And the the role of corporations in preventing this, legislation from being passed is because they pour tens of millions of dollars into congressional races, trying to elect congresspeople that will advance their cause. And so I believe in overturning Citizens United decision from 2010, which was one of the first disastrous Supreme Court decisions that opened the floodgates of unlimited PAC spending in our elections.
Hmm.
And so right now we have in primaries, Democratic primaries across the country, we have what I call a new oligarchy of interests, one being artificial intelligence PACs, one being crypto PACs, and one being APAC. And they're all pouring tens of millions of dollars into Democratic primaries, trying to tip the scales of these primaries. And so I support legislation called the Citizens Over Corporations Amendment. And what that would do would be to kickstart the constitutional process of overturning Citizens United. And so if it were to pass Congress, it would be kicked off to the states, and then 38 states would have to ratify uh, this legislation, which would say that Congress, in fact, has the authority to place limits on the amount of spending in elections. And if 38 states ratify this legislation, this constitutional amendment, it would be enshrined in the Constitution of the United States. It would allow Congress to place limits on spending. And I would just mention that this was a big part of my platform when I announced this congressional run in November of 2025. 16 months into the congressional session, Representative Auchincloss had not co-sponsored the Citizens Over Corporations Amendment, and he has recently decided to co-sponsor this amendment, I think just last month.
Okay. Yeah, I think I saw one of his press releases around that. Yeah. You also mentioned healthcare, which certainly
Mm-hmm.
is, especially in Mass, while
Mm-hmm.
it seems to be more expensive here as a systematic structure, it's functionally broken to a certain extent because I think in your places and certainly in other places I've heard we're spending far too much individually, whether premiums or just doctor visits, and not necessarily getting the quality of care that
Mm-hmm.
is available to other countries and other around the world.
Yeah, so in Massachusetts alone, we have the highest family health insurance premiums in the country, which is about 32,000 a year. And this is going to be more acute because in 2026, about 337,000 Massachusetts residents are going to face higher premiums because these enhanced federal tax credits are going to expire. And so,
Conveniently after the November elections, from what I understand.
yeah, I'm not really sure about the timing of it.
Oh, according
But
to
yeah,
the big beautiful bill, there was a set of phased introductions, and some of those clearly were coming after this election.
mhm.
An attempt by current administration to not make it an election issue, but obviously we know it is. It's coming.
So the reason why I support Medicare for all is because we already pay so much for healthcare, and we're going to be paying more for healthcare, and we receive middling outcomes from that payment. So we pay more in healthcare than any other advanced country in the world, and we receive middling returns from it. So the Medicare for all would expand the traditional Medicare program to include dental, vision, and hearing. It would eliminate premiums, copayments, deductibles, and it would take health insurance off the back of employers. So it would be beneficial for small businesses. It would be beneficial for local governments. So Franklin pays a lot for health insurance for its employees. And it would, more importantly, decouple health insurance with employment. So if you were to lose your job or transition to a different job, you wouldn't have to worry about switching healthcare or losing your healthcare.
Mm-hmm. And the key question there, the next follow on is how would that get funded? I mean, clearly the Affordable Care Act has gone through a bunch of iterations and never really achieved what it was meant to. And yet this, while it sounds great and would expand and give us better health care, money is still an issue. How would you, can you talk to that?
Yeah, so the Medicare for All Act, so the money is funded through the payroll tax. So people would be paying into the system. They would be receiving high quality health care, but they also would not have to pay for the premiums, deductibles, and copayments. And so everyone would be paying into the system, and this is a good thing because the people who need the health care tend to be older and people with serious health issues, and so everyone would be paying into, and a lot of people would also be receiving returns from it.
So everybody paying into it. So if somebody's not employed, they wouldn't have that payroll deduction equivalent, but through some other deduction, i.e. the Medicare through Social Security, et cetera, to cover the others.
Yeah, that's true. Yeah, so it would be paid primarily through the Medicare payroll tax.
Housing. The legislation recently, which the executive office chose not to approve, but at least there was a joint housing bill. It certainly will help, but I'm not sure it's all we need to do. I'm assuming you're interested, and that's in your space. Would you continue to work to advance that?
Yeah, so I believe the federal government has a few levers it could pull to increase the availability of more affordable housing. One is direct investment into direct federal investment and subsidies for mixed development housing, which is mostly an area in which the state has more of a role in developing or promoting. Another area is this idea of eliminating the ability of private equity to pay for or to buy up housing stock. And so in Massachusetts alone, private equity is responsible for about 9% of new home purchases. The third aspect is lowering rental prices. And one thing that is happening is landlords are using these algorithms such as PageRank to artificially set or automatically set new housing prices, and so it can also have the effect of inflating rental prices. And so I think we should outlaw the use of algorithmic rental price programs.
So it'd be kind of like, when you see a particular ad, if you come through one channel, you get one price. You come through another channel, you get a different price.
Right. And it's also it's problematic because it also inputs the renter's, age, race, kind of like employment record, all these like personal informations. And so it can also be biased towards and against certain renters.
Some of which is theoretically illegal, but it's hard to prove sometimes.
Yeah.
So we've covered certainly some of the key buttons. I'm sure there's a few other topics you'd like to elaborate on.
Yeah. So one thing is I talked in the beginning about the importance of organized labor and making sure workers have a seat at the table. And this is particularly important in the age of AI automation. So I do believe that AI automation is coming after a large chunk of jobs, whether it's in blue collar work or white collar work. I can offer a few examples. So one example is last summer, the nurses union in New York City went on strike, and one of their top complaints was that AI chatbots were being used to intake patients. And so if a patient went into the clinic and they were sick, they would be presented with an AI chatbot to enter in their symptoms. And so the nurses had a problem with that. That wasn't like an appropriate use of artificial intelligence,
Right.
and that their traditional work was being displaced. And so they organized, they went on strike, and they were actually successful in leading management to an agreement in which the nurses would have more control over how AI was being deployed in the clinical setting. I'm an advocate for the PRO Act, which would remove barriers to organizing. It would strengthen collective bargaining, and it would reclassify gig employees as legal employees with the right to organize. And this is important in our current economy where a lot of people, especially young people, are taking gig or contract employment. They don't always have health insurance, so that's another reason for Medicare for all. Mm-hmm. But it's also a reason why these workers should be able to collectively organize and try to win the right for employment-based health care. And so passing the PRO Act would be one of my top priorities. Representative Auchincloss is the only representative in the Massachusetts delegation not to be a co-sponsor for the PRO Act.
Oh, so that's one of those key differentiators between you and he. Okay. Voting rights. Clearly, at least as far as Mass is concerned, from my awareness, there's been some expansion, but anything in particular in regards to certainly what seems to be at the federal level, you would then be coming into that discussion. So what is your thoughts on that arena?
So we have to pass federal legislation to counter some of the, I would say, degradements that the Supreme Court has placed on, voting rights legislation. And so one piece of legislation that I would support is the John Lewis Voting Rights Act, which would help strengthen the idea of having federal voting rights protections. And so, so we just need more robust federal legislation to counter some of these recent Supreme Court decisions.
Yeah, because I think from what I've been hearing, at least through the media, and it happens on the healthcare side as well, some of the states are taking action to reduce in areas so that as an American citizen, if you're moving from one state to another through a job change, you're not going to have the same level of, quote, citizenship, access, and rights, depending upon where you move, unless these kinds of, federal level legislations are enabled.
Mm-hmm. Yeah, and so what the Supreme Court has recently done is kind of dismantled this idea that the federal government could be monitoring worst offenders in terms of states that are stripping away voting rights. And so what the John Lewis Act would do in Congress would be to kind of restore and protect these federal oversights. Because, we don't want a situation where state governments are kind of tinkering and diluting the ability of voters to be able to go out into the polling places and vote.
And anything else? I think we've covered some of at least the key topics that I've been aware of. You may have another issue or two you want to talk to?
Yes. And so another main theme of my campaign is that we're spending too much money on war and not enough money on healthcare, housing, and education. And so the House of Representatives just passed Trump's $1.5 trillion budget increase, which would go towards the Pentagon. And this is more money that's ever been spent on wars since World War II, inflation adjusted. And we're spending more money on war than the next 10 countries combined. And the Pentagon itself has never passed, in the past 8 years, a federal audit. And so this is widely reported that the Department of Defense has failed every full audit in the past 8 years. And so I would support legislation that would pare down the Pentagon budget every year that it fails an audit. I don't think that we need this huge growth in Pentagon spending. I think that instead we should bring that money home. One clear example is IDEA spending. So this is special education funding that goes towards states and federal governments. Congress has decided that it can find $1 trillion or $1.5 trillion to fund the Pentagon, but it's not going to fund the 40% of special education that it promised. So currently, federal government funds about 15% of special education. So I think that instead of spending money on war, we should be funding things like special education, and that's going to take tax burden off of local governments like Franklin. So Franklin reports that its local government is education is the top budget issue, as it should be, but a lot of that cost is going through special education. So if we could instead get the federal government to live up to its promise of 40% special education funding, that's going to take a lot of pressure off of local governments, which can then use the money in other areas.
Mm-hmm. Okay. And then related to that, the SNAP benefits have certainly been decimated and seem to be continually taken advantage of by the federal government, which, again, there's no state level. There are nonprofits who now have to effectively fund that gap because the state itself has some issues, although they've done well in the lunch program for the elementary students, et cetera. But, that only can go so far.
Yeah, in terms of SNAP benefits, so we're the two agencies that have seen the largest increases in federal funding are one, the Department of Defense, and the second one is Department of Homeland Security, which has experienced a tripling of its budget. And why the growth on these two particular agencies, I think it has something to do with the fact that these two particular agencies is where a lot of private tech contractors get their money from. So companies like Palantir, companies like OpenAI, they get a lot of money from government contracts through these two agencies. And so I think it's systematic corruption that we are putting more money into DHS and Department of Defense, where it then gets funneled into these private contractors. And we're not spending the money on things like SNAP benefits for people or enhanced health insurance credits or special education funding. And so it's getting siphoned up into these private contractors and not towards the hands of the people who need it most.
Right. Question of priorities. Yep. Well, thank you for taking time to elaborate on some of the key issues. Clearly, we would have to talk probably another couple of hours to elaborate further on the rest of your issues, but we'll include in the show notes links to your page, your contact info. I'm assuming you're responsive in meeting others and being at other public events in order to engage in the conversation with the other mass voters.
Yeah, thank you so much, Stephen. If I could just end by saying that the early voting period for the September 1st primary starts August 22nd, and the primaries are decided about who shows up, and so it's in a lot of respects more important than the general election. So it's really important to vote in the September 1st primary, and better yet, vote early. And then you can come knock on doors with us. We often have canvassing events in Franklin. You can go to poulos.house/canvas to join a canvassing squad. And third, after I win this election, you can hold me accountable onto the things that Franklin cares the most about, which is, stop sending the town bills for decisions it didn't get to vote on.
Okay, thank you. And again, thanks for taking time. And to the listeners, thank you for taking time to listen. And again, the show notes will have the info to get to Jason and follow up on that front. And a quick reminder, of course, we do this because Franklin Matters. We are now producing this in collaboration with Franklin TV and Franklin Public Radio. This podcast is my public service effort for Franklin, but we can't do it alone. We can always use your help. How can you help? If you can use the information that you find here, please tell your friends and neighbors. If you don't like something here, please let me know. Through this feedback loop, we can continue to make improvements. And I thank you for listening. For additional information, please visit franklinmatters.org. If you have questions or comments, you can reach me directly at suresteve@gmail.com. The music for the intro and exit was provided by Michael Clark and the group East of Shirley. The piece is titled Ernesto Mañana, copyright Michael Clark and Tintype Tunes in 2008, and used with their permission. I hope you enjoy. By the way, you can also subscribe and listen to Franklin Matters Radio on your favorite podcast app. Search in podcasts for Franklin Matters.